Hi, my name is Dr. Terry Armstrong. For more than 30 years as a nurse practitioner, I provided care to people living with brain tumors. As a clinical researcher, I focus my research on how these tumors and their treatment affect daily life, not just for patients, but for the people who cared for them. Through this work, I learned that there are certain moments that feel especially overwhelming. Moments when knowing what questions to ask, what truly needs to be decided right now, and where to seek reliable information can make a meaningful difference. This video is not medical advice. It is guidance meant to support you or the person helping you in understanding what actually needs to be decided right now. Because decisions made here can shape everything that follows. This series, When a Scan Changes Everything, part of Brain Tumors What Helps, was created to support you during one of those moments. If you're watching this, a scan has likely shown something concerning in the brain, and you're being asked to make decisions and move quickly, often before you fully understand what's happening. This moment is not just emotionally difficult, it's overwhelming, making it hard for you to think clearly. When a scan reveals a brain mass, it creates uncertainty, not certainty. At this stage, you usually do not yet have a clear and final diagnosis. You may not know what kind of tumor this is, how serious it might be, or what it means for next steps in treatment. You may be making decisions on your own or with someone helping you, often referred to as a caregiver. Caregivers can be there to provide a second set of ears so you don't have to make decisions alone or remember everything that was said. Or sometimes you may not be able to fully participate in decisions because of the symptoms you're experiencing or the stress of the situation. In those cases, caregivers are not just helping, they are deciding. So whether you are the caregiver or the person with the tumor, your first step is to pause, to ask questions, to gather information, to allow you to make informed, thoughtful decisions. Start by asking yourself one simple question. What kind of decision is this? Some decisions can't be undone. Surgery is one of the clearest examples. You may not yet know whether surgery is an emergency, something that needs to happen soon, or something that allows time to gather information. Before committing to surgery, it is important to understand whether it truly needs to happen right now. The healthcare system often moves quickly in this moment. That does not always mean immediate action is medically necessary. Not all urgency is medical urgency. Sometimes it reflects workflow and scheduling, or caring people trying to help you by moving quickly during what is a very difficult time. It is okay and important to pause and ask questions before undergoing surgery. To help you do that, I put 5 questions together that protect decision clarity. They are also available as a one-page download, so you can print or view them on your phone during the conversation with the neurosurgeon. Here are those 5 questions. Question 1. Is this a medical emergency, or do we have time to gather information and prepare mentally and physically before surgery? Question 2. If we have time, how much time? Days, weeks, or longer? And what do you advise I do to prepare for surgery during that time? Question 3. How often do you perform this specific surgery for the type of tumor we believe I have each year? Question 4. What team of healthcare providers is in place to support both you and I before and after surgery? As an example, do you have an expert pathologist called a neuropathologist who will review the tissue and perform molecular testing to help you make the diagnosis of my tumor? Question 5. Would care or a second opinion at a specialty center change outcomes for me, such as treatment options available or how I feel or go about my day? If so, where would you recommend that I go? These questions do not slow care. They protect decision quality, and they help ensure you have the information needed so you can make that decision and that future decisions align with what matters most to you. I hope this helps in your journey, and I wish you the best.